represent the Philippine Medical Society of Northern California. My name is Dr. Maria Araceli de Guzman. I am the coordinator of the mission to Bohol. This is the President, Dr. Carmen Agkawili of the Philippine Medical Society of Northern California. And to my left is Mrs. Bernadette Rocco, who is our travel and mission liaison. We are at the Cultural Center of Bohol, which acts as our outpatient department. Upstairs in the bleachers is our optometry center, where we see patients being refracted for eyeglasses. We are giving away hundreds, literally, of eyeglasses. And today we are seeing at least probably 1,000 patients today. Yesterday we saw over 900. So as word gets around, word of mouth spreads, we get more and more people. We have dental services, we have specialties, and we have also surgeries, major and minor, going on at the Governor Galeares Medical Center.
from San Francisco in the US, and we're here in Tagbilaran, Bohol, and we're here doing our medical mission, which we do every year. We go to a different city in the Philippines every year, and we try to help the indigenous people here and those in need.
I had the statistic team for the medical mission, and my team is comprised of two other people, that's G and Gail. And the statistics team has been doing this for every medical mission, and this is a way for us, for the team to report the story of the medical mission through the numbers.
Hi, I'm Dr. Peter Breton. I'm a transplant surgeon and urologist. I'm also the incoming president of the Philippine Medical Society of Northern California. We're here to complete our medical surgical mission for the people of Bohol. And I oversee the overall surgical team here. Dr. Vala, you want to tell them what you're doing, what kind of surgery?
This is a cleft palate patient with a concomitant bilateral cleft lip, which was repaired years back. So now we're doing the palatal patient, just to close the whole thing. This is the 10th patient for this week.
Thank you. So we have people from all over the United States. Dr. Vala is from Manila, but you want to tell them where you're from?
My name is Maria Rizal Oculam. I'm a physician assistant. I work for Kaiser Permanente in orthopedics. That's in Southern California.
Anybody else want to introduce yourself?
I'm from Daly City, California.
Hi, I'm a nurse from Stanford, in Palo Alto.
Hi, I'm Maria Costello. I'm from San Jose, California.
Mike.
Doc Mark.
Hi, I'm Doc Mike from Manila.
Hello.
Perform 26 majors and maybe an additional 30 to 50 other minor surgery cases. And I think Tuesday was about the same number. We hope that each day we become more efficient, and today we'll do at least as many or maybe more and go on to Thursday as well. So this is Dr. Kachanta, and he's operating on the thyroid.
Thyroid cancer.
Thyroid cancer.
Thyroid cancer.
That was diagnosed 4 years ago.
No treatment.
No treatment.
These are two students from the University of California at Berkeley, and they are Filipino descent, such as I am, and they have volunteered their time, even before medical school, to come here and volunteer their time to see what the medical missions are all about. So they're the future of this medical mission, and hopefully it'll go another 30 years, understanding the interactions of Californians and Americans of Filipino descent coming back to the Philippines to help. So, what do you think? You want to tell them anything about yourself?
Well, yeah, we're from UC Berkeley, and really we just came here to give back, to like donate the talent and like time that we have, and learn from everything that we can learn from, gain experience, and just share everything that we can.
And like you said, because we are Filipinos, it feels great giving back to a community that we specifically relate to.
Anesthesia recovery room, and it also serves as the pre-op staging area. So I think this is one of the most important places, and we're going to go in there. There's a baby crying that Dr. Avala had just completed a cleft palate. When we hear a baby cry, that's joy, because baby's waking up. He or she has pain. The lungs are clear, and the anesthesia has worn off, and that baby is going to do well. So this is typical. I like that sound. I've gotten used to it. But let's come on in.
Did you check the other room? Don't check the other room. Open.
This is actually a 1.5-year-old baby that I operated on with hydrocele of the testicle. She is our post-op recovery doctor. We have that luxury here. We usually don't enjoy that in most post-anesthesia recovery places. You want to tell them something about yourself? This is her first mission?
Yeah. Yeah, so this is my first one. And yeah, this is similar to what I do back in the States, but the patients are a much different size and younger. But yeah, just helping the nurses make sure they have the drugs that they need, looking up doses of drugs that we have or don't have available to figure out what to use, and trying to keep the patients coming in and out in a safe fashion so they can have their surgery.
And how's it going so far? What do you think?
I think it's going pretty well. We're learning to function without air conditioner, a bunch of postmenopausal women. But it's okay, we're doing all right.
In a busy outpatient surgical outfit. We're doing a good job. People are happy. Patients are satisfied. Hopefully they are, of course. But we're doing, I think we're doing an okay job. We're so glad that we're able to help the people in here, and we thank them for the trust that they're giving us.
We are doing cataract surgeries and tritium surgeries for patients. We're going to do about 100 patients while we're here this week. Most of the surgeries will be done by the local doctors, and doctors from as far away as Cebu have come to help out. This is a patient who has a subluxed lens, and I'm just having him lie down to see where the lens is going, so that when we do the surgery we'll be able to know a little bit more about what to expect. We have a patient next door who's blind. We are measuring for the lens implant power, and you can see that the lens in his eye is completely white. So his vision is not useful to him at all.
dynamic leader of the Philippine Medical Society of Northern California, our President, Dr. Marlene. And of course, your very dynamic coordinator who came here to make sure that everything is well in place for the mission that is arriving in Bohol, Dr. Maria Araceli de Guzman. Let me also acknowledge some very special persons who, together with Ambassador Machado Painor, came some months ago to make sure that we network and strengthen our communications and linkages in preparation for this event. Ms. Bernadette Rocco, and Father Arnold Zamora, who is not here, but I would like to mention him as well. The other members of the Philippine Medical Society of Northern California, and the rest of the volunteers that have joined the group, and all the other members of the delegation, medical staff, doctors, nurses, pharmacists, and the other support staff, people working with the logistics and all. On behalf of the 1.2 million Boholanos, allow me to express our deepest thanks and appreciation for your visit, for the mission that you have organized, and the passion that you have shown to the people of the province of Bohol, especially those who are in need of medical attention. We in Bohol are very lucky to have people from abroad who have always been putting their hearts into the service of humanity. I always consider your mission and your task as a very, very important component of the Christian belief and our own belief that each person is really a man for others. When God gives us gifts, it's not only given to us for ourselves, but it's given to us as well, so we can share it with others. And I believe that that too has been the driving force in the 29 years, I was told, of the missions that your group has organized. I would like to ask everyone to clap for this particular achievement. And let me also say, with the 7,667 patients under your care during the last 3 days, 3 or 5 days, that is a number that to me, to us Boholanos, has been the biggest number of patients served in one singular mission. And that is the record in the province. And when I came over here, just talking to our leaders, Dr. Kawili, Dr. De Guzman, it's very surprising that our roads somehow met some years back when we were taking care of one patient who eventually was brought to the United States under your care. I never thought that you were the group handling and taking care of Benjamina, the first patient of the course that was treated under the care of our very, very special friends. We would never get tired hosting your missions because we know that your commitment has always been very, very strong and very, very committed to serve our countrymen. So tonight, let me express on behalf of the Boholanos our deepest thanks and appreciation. Let me express our thanks to the whole Philippine Medical Society of Northern California.
So on behalf of the Philippine Medical Society of Northern California, I would like to thank Governor Chaco and his staff, Mayor Babayak, and of course Dr. Borman and his staff, the provincial health officers headed by Dr. Arfan, the local dentists and doctors and the optometrists, and all the people of Bohol for welcoming us here. The doctors, nurses, dentists, pharmacists, PAs, students, and especially my support group. I would like to congratulate you for a job well done. The Apostle St. Luke says, "For whom much is given, much is required." You are the fulfillment of St. Luke's testament, for you have graciously given your time, money, and skills to those that are in need. You just don't know who you touched this week. But let me tell you a story. Some of you may have heard this. Many years ago, about 50 plus years, there was a man in one of the islands here in Visayas. He was slowly dying, but for the doctors of a medical mission, he got better and was able to migrate to the United States. In the US, he bore a son, and that son became not only a physician, but a great surgeon. And he is here with us today. That surgeon is Dr. Peter Britton, the next president of the Philippine Medical Society. There might be one or two Peter Brittons in that people we serve this week. So I hope you find fulfillment in that story. Again, to the governor, the mayor, Bohol health officers, Dr. Borja, and their staff, and to the people of Bohol, a big, big thank you.